I don't think the public actually knows how bad things are. And you can't maintain universal healthcare if you have a public that doesn't actually understand what's really going on, because otherwise we're just going to keep doing the same things and they're not working. Like, I really am worried about our healthcare system. We are going to continue to lose so many good people because I think things are going to get worse before they get better. That breaks my heart. It breaks my heart.
I'm worried about the next 3 years more than I was worried about the last 2. Because people are tired. Our resilience isn't there. My resilience isn't there.
People have experienced a range of experiences. Some would define as traumatic.
It's worse than I thought it was going to be. And the consequences are greater than I thought it was going to be around the burnout.
We have got to stop pretending that working in healthcare is a normal working environment, because it's not. And the trauma that people experience as they try to hold the system up is really, really heartbreaking.
This isn't the happy place of work that it used to be, because I had changed as a nurse and I had changed as a person.
I realized on my day off, I had done 10 hours of work as fast as I could go with no breakfast or lunch. And I burst into tears. I thought, what am I doing to myself?
Do I really want to continue doing this? Is this my career that I want? Is it too much? Is it too much of a stress for me and not healthy?
The ongoing chronic stress that the pandemic has wrought, and the constant uncertainty, I think it is really taking its toll on healthcare providers.
They're just burnt out, completely.
I think as healthcare workers in general, we can all say that we're definitely, had our fill.
I'm not the only one who has, some lasting kind of mental health effects from working in a pandemic.
We've had our entire team run into the ground.
There was going to be no rest and recovery period. It's not coming.
Things look bleak and it's just unsafe. There's some safety issues going on, can't even get basic care done.
We're definitely getting to the end of our rope, because you can only give so much.
I kept thinking, I can't do this anymore. I can't do this. I don't know how to do this.
It feels very overwhelming. It feels heavy.
Yeah, it can become too heavy sometimes.
The gas tank for compassion is low in our society right now. We see it in our waiting rooms.
When you're burnt out, you start to have compassion fatigue. Unfortunately, you have no control over that. And that's something, it's kind of shameful in nursing, because we're a profession built on compassion. And to not have that for a period of time is alarming. It's upsetting.
That drive to kind of come to work and enjoy it has definitely disappeared in some.
People are done, and they're tired and they're burnt out.
I feel a bit of shame about maybe when I feel like I stopped caring for people emotionally. I did my job. I don't think anyone would have noticed a different level of care, but I felt really numb to what I was seeing.
We're in a crisis on top of all these other crises, right? I think it leaves me in some ways feeling a bit numb, to be honest.
This high acuity, these volumes, these shortages, and you've kind of just take it for granted now. It's just become the norm.
We're seeing enormous increases in other health-related issues. The sort of chronicity and the ongoing chronic stress that the pandemic has wrought, and the constant uncertainty, I think it is really taking its toll on healthcare providers.
What I saw during the pandemic with my workforce and colleagues is that we lost the ability to share time. We lost the ability to show the human aspect to who we were in being behind a mask with gloves, in not being able to touch. And So it became a lot more isolating, and we're very isolated.
People are making the best decisions, most ethical, compassionate decisions they can on a daily basis. I think that's important, right? I think that's where one of the challenges were when or not challenges, but one of the more difficult things is when that intention was challenged. People make mistakes, but you shouldn't really question what the intent was.
Coming home exhausted, feeling like I didn't do the best I could, even though it really was the best I could, just in a new set of circumstances.
I know there's definitely some people that have felt almost like jaded by work, and it's something that they don't like enjoy being there anymore. Even now that we're not seeing as many cases anymore, I definitely hear sometimes where people are just like, oh, I don't want to be here anymore, and it's more of a job just to kind of sustain, their living than it is something that they would enjoy.
Who wants to do this job? Like, who wants to be in this career?
There's enormous pressure in working in healthcare.
This has changed us. This has changed our healthcare system. It's changed me. It's changed my colleagues. It's changed our families.
I don't think we're going to go back to the way the system used to be.
It's been a seismic shift in society, not just healthcare.
But everybody's in trouble.
25% of workers have experienced PTSD through the pandemic, and that's just pandemic-induced PTSD.
50% of psychiatrists in Canada are over 58 years old. What's going to happen? We're either going to die of a heart attack from working too hard, or we're going to be smart and retire, and there's no one to replace us.
That's a quarter of our workforce on top of the 40% that were already telling us they were burnt out before the pandemic.
We are facing a psychological health and safety emergency in our system.
It feels really, really broken right now.
The year ahead that we have with some of the realities of the pressures, that worries me a lot. And I honestly don't know how to do it.
It's very hard to sometimes feel like you're swimming upstream in a system that's not functioning very effectively. So I think unless major primary care reform happens, we're going to see more people exiting the profession.
I think there is still a lot of burnout and a lot of pain that people are getting over. We're not nearly done. I think society needs to realize that. And when we see nurses quitting in large groups, respiratory therapists wanting to leave work or leave downtown and move somewhere else, this is a real threat to us, right? And to society. We need our healthcare professionals.
It's not over. And I think the mental health consequences of this is going to be big. And I don't think we've seen the end of it yet.
And part of me wonders what my family would be like and where we would be at if it wasn't for the pandemic, right? And I feel some anger at that, the impact that I'll wear for the rest of my life because of what we've been through.
This is going to be the challenge of our generation.
We're not going to treat our way out of this problem. We're going to have to reform our way out of this. We can't stop healthcare. We can't pause. We can't go home for the week. But is there a way to create an acknowledgement and a marker of collective reflection of what's been endured, so that there can be a step forward to creating resilient systems? And it's complex. It's multifaceted.
I think the way that the healthcare workforce can be assisted in healing is by public recognition, leadership recognition, and the awareness and the offer and the openness to be able to speak and to start talking about healing.
I think people are exhausted, but I think being able to move forward from that involves people being honest with themselves. And I think a lot in medicine that we're we're not really trained that way, right? We're not really trained to show vulnerability.
I need to work through my feelings and think about how I felt and look after myself. I suppose that's would be the next thing.
And I think the complexity of caring for people has really evolved over the years as people live longer with chronic diseases.
So you have to be on, and you have to be, you have to keep up that pace, and you have to stuff your feelings because there's work to do.
You don't generally talk about it with too many other people, how you're doing or what it's been like.
You need time and relationship, and our current system, outside of clinics like ours, where we are very lucky to have a team and time, our current system doesn't allow for that.
We have to build our relationships. Building it is just slowly communicating with one another, talking to each other, following through on what you're saying, and continuing down that path.
And so what we've been trying to do is just make sure that we take care of each other and we give each other space and grace and time to process this the best way that we can.
Well, it just reminds me of a time when I booked off after having a really bad shift. I came back to the station and one paramedic I'd worked with a shift or two, and another one I'd only literally just seen at the hospital a couple of times while working shifts. But I got the most supportive, welcoming, enveloping hug. And there was this, you don't need to talk about the trauma, like that's not what we're here for. We're here to ask about how we can help you.
I don't know what the answer is for the system, but there needs to be a change.
We can't change everything in the system, but we can change one or two things. And I think that's important.
The need to reflect back and debrief and process and in a way that is necessary to move through so that we can go into the next present moment, not in a way that gets us stuck in the trauma or the wounds that happen from the events, but that allows us to see them, to acknowledge them, to validate them, and then so that we can move wholeheartedly into the new space that emerges. And so there's this, we see it as this big space of honoring that transition, and that is the work.
It might mean that we have to pull back or hold back on some things that seem like priorities and probably are priorities, but it's maybe just realigning the priorities for the time being and having some patience. I think that's the other thing within our healthcare system is there's often a little bit of lack of patience in terms of change. Change always seems to have to happen quickly. And this might be a time to reprioritize what the important things are. And I would say putting healthcare provider well-being at the top of the list.
The biggest worry I have right now is the risk to quality is our people. That is the number one thing we need to be focusing on right now to improve quality of care.
If I was to focus on one thing, it would be the people that work here and the people on my team. Making sure first their well-being is the first and foremost, that they have that balance, or at least know that we have their back, and that that we're focusing on them. I think that's the most important thing right now, is focusing on our people.
I don't think we've seen something of this magnitude before. And within that magnitude, there's absolutely a need to acknowledge and name that our mental health has been impacted. I think it's happening in pockets, but there is an opportunity, I think, to name it at a systems level.
Usually the way we make change and make improvements is to engage people in initiatives and projects to make things better. But I don't even know how much capacity people have to do that, and yet I think that's part of the solution.
You know, during that 2 years of the pandemic, if you'd asked me what the rewards are, I would have said none. And I do think, actually, even just the process of talking to you, I've realized that I've I've come a bit back to the other side, a bit better, more balanced myself.
At some point, there's some people that just need to be able to debrief, get it off their chest, and then they can move on. They just need to feel heard. There's other people that need more help than that. And there's people that actually need to take time out of the workplace and really get a different perspective and do some different work for a while.
I think there needs to be a whole lot of paid leave now. I don't care if they pay me. I would like a couple weeks off.
The difficulties with people burning out or operating on the edge of burnout have been there for a long time, long before the pandemic came around.
Ignore the mental health and well-being of healthcare and community social services at the peril of the system.
I think I, within healthcare as a healthcare leader, also need to allow the space and consent for and the time to allow people to recover, to speak, to connect, to rebuild in a way that is compassionate and human.
The opportunity is listening and really hearing where people are at and asking people what they need. I think before we do anything, we have to stop and ask, what are you worried about? What are you needing in your role right now? And actually tying the work that we're doing to those priorities of those working day to day. That's number one.
Listen to people's stories. Listen to what they've gone through. I've always said our people need to start sharing our own stories and stop making yourself small and making it better for other people because you don't want to hurt their feelings. Share it, because how does change happen? You need to open it up. You need to tell those stories. You have to say it.
We have to also pay attention to the provider experience and the quality of their work life. Because if we don't, then everything else doesn't really matter. All of the other quality initiatives, everything else that we're trying to improve or change in healthcare won't be possible if we don't.
I'd also request that we try to deliver care but slow down in a way that allows space for the system to heal.
It's impossible to go from high negative energy, which is where we are right now, where everybody's very busy, there's lots going on, but people are feeling tired and burnt out, to a high positive energy. It's impossible. So we have to look at opportunities for slowing down.
We have to make space to recognize that the mental health impacts.
Mental health is always looked as taboo, and it shouldn't be. It's not. Like, it should be right in there with our health. It should be, because when you're not taking care of yourself, how are you going to take care of others?
I think if you ask most healthcare providers whether that understanding and support and openness to hearing what healthcare providers feel they need, I think most would say no, that does not exist currently.
We have a lot of programs to assist healthcare workers who not just are struggling, but to just have these regular check-ins. But I don't think that many people access it, or as many people are accessing it as often as they should. So I think that instead of putting the onus on the healthcare workers to access it when they think they need help, I think that this should be part of the regular work cycle or work program.
There is workplace mental health supports always. They're not known for being exceptional, and they're generally just used for, like, you had one traumatic event, you go talk to a professional once or twice, and then you're kind of on the road to not being traumatized anymore. But for something like a pandemic, that's not appropriate, and we weren't really given alternatives.
I don't feel like, from an RT's perspective, and even from a nursing perspective, where there's enough compensation for us to physically be at work, and that kind of drives people away. And I think the biggest thing for, like, the mental health aspect of things is that if there's not enough staff, then there's more overtime. There's more overtime, there's more people picking up, and when you pick up extra, it causes extra strain on your capabilities.
We really need to be looking after ourselves and each other, and we can't always count on the system to do it for us.
We have systems that break down people's resilience, that don't support people properly.
By the end, it was like, just figure it out. Just, I don't know, you made it this far, you can keep going. And it puts the onus on the individual to find support for themselves, when I think it should be the employer who is like, you are suffering no matter what you say, and here's what we can do for you.
If I have to hear one more time that I need to do more yoga, or I need to be more mindful, or I need to run more, I'm gonna lose my mind, because as individuals, we can only be so resilient.
It needs to be done in a really authentic way that doesn't solely place responsibility for resiliency back on the individual, because we are resilient people. We are already incredibly resilient. Resilient people are drawn to this work.
Relying upon individual resilience won't get us to the level of recovery. We need to create conditions of work, or conditions of practice, or conditions of employment where we have the fallback. We have the systems in place.
You can have a new building, you can have new equipment and that stuff, but if the people there aren't engaged and aren't supported to give great care, then that's going to impact the quality of care.
We're all humans, that we're all people too, right? And the whole system, we talk about the system as if it's this magical little robotic thing that happens. And it's like, no, the system is made up of people, of humans, of moms and dads and uncles and brothers and sisters. And, you know, we have far better, bigger roles in life than the titles and jobs we occupy. So we have to remember that, right?
It is my individual responsibility to be healthy at work. It's my responsibility to do my best to, bring my best self forward. But I don't work in a vacuum. None of us work in a vacuum. So what I think we need is to cultivate resilient environments, which involves really, in my view, emphasizing the human aspect of a healthcare system. I think in public discourse, we imagine that healthcare system is buildings and equipment and medication and supply chains, and it's all of those things. But the most pervasive element in that system, the most common grommet in that system, is a human being.
We need to do better in terms of telling our story. I think we need to do better in terms of being able to hear what we have gone through, to put it out there, to speak about it, to understand it, to recognize it, to change healthcare such that we can listen, and that we don't have to stand and say, it's fine, I'm okay, I'm going to continue on.
We absolutely have to create systems that wrap around our people. Systems that say, I actually see that you're starting to experience some moral injury here. I'm seeing that you're exhausted. I'm noticing that you've worked the last 5 night shifts. What can I do to support you? What is the system doing to support you?
It's constantly reminding ourselves that we're human, that we have feelings, we have needs. We can't just give.
We learned a lot during the pandemic, and we learned a lot not just about communicable diseases, but I think we learned a lot about our system and more so ourselves as individuals and as teams. And I think as long as we keep having these conversations about how can we improve, how can we take better care of ourselves and each other, we're going to have a much stronger healthcare system in the years and decades to come.
I think it's going to take some time. It's going to take hard conversations, but I think the first step is listening and acknowledging that this is hard, but taking those little steps and showing that we care for each other matters.
Now we need to be asking that to the healthcare providers. What matters to you? And how do we address that? And how do we build the right environment again for them to work? Because if we don't address that, people will continue to leave, and then we won't have enough providers to care for the patients.
Have the courage to ask the question, which is, how are you doing? I'm concerned and I care about you. Simply listen to understand.
There's not really a short-term solution that's going to solve all.
We have to look at lots of different solutions to really start to support people in the way that they need support and in the way that they're telling us they need support, as opposed to us trying to come up with solutions for them. I think we really need to listen to where our healthcare workers are at and to say, what is it that would be helpful for you?
And so when you design from the top, you typically miss the mark and you miss opportunities for engagement, which is why I think you have to start from those at the point of care.
And that's been a problem in the healthcare system as well, is that many people think they know what's better, but they're not getting the input from the nurses or the doctors. And it's like, what is going on here? You're not going to be doing this care. You don't understand it. You're not even trying to understand it. You're trying to dictate and tell us what we should do when you should be watching and learning and trying to figure out and working alongside us to figure out what's the best solution.
I feel like it needs to come not just from your coworkers, but I feel like from above, that they to engage more in that teamwork part, like join that teamwork part and kind of see us on the same, I don't know if that's the right word, but the same level, like have them engage more with the whole team. In a team-based approach, we could all kind of just, if we could all just bring ourselves down to one level and really work together, our patients will reap the reward of that.
How do we move out of transaction, command control, results, to a place of relating to each other?
The system, this magical system that we think is a system, is actually people. So it's people upholding policies or pretend policies, things that they think are real and are real important to this organization. I don't think it's always true.
But we can't continue to say, we got to wait for the ministry to fix this, or we're going to wait for our politicians to fix this. That's not their job. Their job is not to be in the operations of healthcare. Our job as leaders in healthcare, our job as providers in healthcare, is to fix the system that we're in and to support people to be able to provide care in a really good way.
Make sure that the politicians that you're voting for have healthcare as one of the top reasons on their platform. Because, you know, we can talk about it, but it's part of the government that will help us get there.
We know that 50% of female physicians are working 50% half-time by the time they're out of school 5 years. It's great that women want to have children and be doctors. So double the number of people in medical school.
Maybe, looking into getting, better wages or more competitive wages across the country that can keep people or retain people to work in BC will be probably the first and foremost thing that I can think of that would help.
We need more resources, whether it's more nurses just as a whole. But with that comes with more volume. You need bigger hospitals, more beds, more long-term care beds.
Sometimes work environments can get so focused on things like staffing that the focus away from how can we do things better with what's here now, sometimes that can get a bit lost. And I think refocusing that to talk about, well, with what we have, how can we actually get to quality? It doesn't always have to do with having more staff. It doesn't always have to do with how many sick calls you have. Sometimes it has to do with making time to talk and plan, right?
We have some phenomenal thought leaders in this province that can actually come together and fundamentally shift the way we provide healthcare. It's going to be the only way we move forward.
Part of the problem is the lack of psychological safety.
You have to have the psychological safety to be able to try that and to fail and to know that you're not going to lose your job. or get called before someone and get yelled at because you made the wrong decisions. You can't innovate without making mistakes. We don't have a culture where failure is okay, or learning from our mistakes is normal.
Even for myself, to actually say what I would want to say.
So how do we create channels for people to safely raise their hand and not lose their ability to practice? There's one challenge that we have to meet. So that would be a systems level response, right?
Everybody needs it in order to actually create a true system that has psychological safety that will get you the outcomes that you're looking for.
Now's where we need people to come into healthcare that want to make healthcare better. Because if we don't have that dream and if we don't hold on to that hope, we will lose healthcare. We will lose our publicly funded system.
Then comes that transition out of the crisis, where we have to both feel the feelings that maybe couldn't come up because the doings were so necessary. So transitioning out of crisis can be really, really difficult because it comes with all the emergence of feelings, the emotions, the what next. And transitions from our perspective require, compassion and attention and are as real as the next step.
And so we also are individuals within systems that interact with other systems, of which the medical system is one. And so the practice of compassionate leadership to strive to make non-judgmental observations rather than make a judgment about something that happens. And by doing that, we can then, if there are strong sensations of feeling angry or scared or hurt, we can find the unmet need and use our wisdom and experience and even support one another in identifying what those needs are, and be seized with supporting meeting each other's needs by making very clear requests of one another.
It is a time to get curious. When we take the time and we explore and we settle into the discomfort sometimes when we're hearing somebody express, maybe a strategy or an emotion, and we get curious and we ride through that, my goodness, we can come up with some good strategies.
And so systems change really is about getting curious first about ourselves and then seeing where we are within a system. And then once you see this dynamic, you can't unsee it. Now we're responsible for choosing what to do with it. So we see each other first, and that if we know that others are also traumatized, that we go slow to go fast, which is counterintuitive to the way so many of our systems operate. And how do you do that? I know in our work, we work to shift and slow down the cadence of the work, and also not to be afraid to make mistakes, but to embrace them as learning opportunities, stay curious about them in a way that we don't harm ourselves, we don't harm others, to be seized with adding to the well-being and happiness of others, even if we don't agree with them.
What I've really learned about my coworkers are they're a pretty amazing bunch of people. If I didn't have them, I think I would have hit my breaking point this year, in the last 2 years, and I probably would have walked away.
Knowing my colleagues and really seeing what they did, which was really quite inspirational. Like, it's an understatement to say it's quite inspirational, but it was really inspirational to see how people responded.
I've spoken to a few of my colleagues about, what COVID has meant to them. And I think the words that have come up, outside of the fear and the uncertainty and the loss, because there has been a lot of loss, has been that it has been a privilege to be witness and be intimately involved in what has happened.
COVID has shown that we can work creatively and thoughtfully together.
COVID has revealed our gaps, and so in some ways we need to be grateful for that. I mean, maybe I shouldn't say that, but I actually do feel and sometimes glad that people are talking about something that we've never, at least in my career, haven't talked about before.
I've learned to recognize when I'm doing too much. I'm learning to put up my boundaries.
So I think I'm a better advocate for myself now, and I didn't know that about myself. and that I'm an advocate for other people. Like if other people are really struggling, I'm going to support them to do what they need for themselves.
Thanks to COVID, I've taken a restock of my capacity, my resources, my goals of care. And really distilled down for myself what I enjoy about being a healthcare provider and a first responder.
It might feel scary, everything you're hearing about the pressures in the system, but the opportunities that you have going into healthcare, especially nursing, are endless. It is probably one of the best careers you can have right now.
I would say go for it. As much as you're hearing in the news and from people on the streets, and if you are sitting there right now thinking, is healthcare the right choice for me? Should I really do this? Absolutely. If you're thinking of doing it, now's the time to do it. And you could never find a better work family than a group of healthcare workers.
The beauty of the job is it's so diverse. You can do so many different things, and I've done a lot of different things within the scope of nursing. For me, being an ICU nurse meets kind of my own personal needs of being a geek, and also because I love people. So that's partly why I've come here and stayed, because it's so interesting and it changes all the time.
Every day is a new day, and you don't feel, again, stale in your work. And with each new case that you see, you're learning new things, and I think that for me is very mentally stimulating.
Don't do it because you feel like you're going to get a tremendous amount of love and high fives or something. I think you should really do it because you feel called to it.
For people who are driven by helping others, this is the best place for you to be. Because even though you hear about the challenges in the system and the frustrations in the system, that opportunity of even knowing you're making a difference, even for one person, gives you the fuel to do all the rest.
You have really good relations with the physicians that you work with, and like amazing nursing staff in either places. And for me, it's just a lot of fun to be in a workplace where I feel like I'm not working with coworkers, but I'm rather working with friends.
Small acts of kindness, humility, grace. I see that all the time in my patients, and that's what keeps me coming back to this work. And it's really taught me how to be a human because I am able to bear witness to so many beautiful small acts of humanity every day.
When anybody tells me that they want to become a nurse, I tell them, you should do it. We need nurses right now, and it is a hard job. It's very hard.
So I would still encourage people to be in nursing, with the caveat that it's underpaid and in a lot of ways undervalued. So if you're doing something for money, nursing is not the profession for you.
And I try not to sugarcoat it because they need to know what they're getting into.
The way I see it is that if you're in medicine, let's say, or healthcare, you're doing it for more than just the job and the money, right? Like, you want to do good.
You really have to have a sense of a higher purpose for it.
You have to have that heart.
The ability to help people sort out their lives and have meaning and purpose is profoundly important work and a profound privilege. And I love doing that.
I mean, there's nothing better in life than feeling that you're working towards change and you're making a difference, right?
For me, working in healthcare, it's really important to know why. Why do you work in healthcare, you know? And there's so many reasons people can choose to. I mean, maybe they're not sure, maybe they're just looking for a job. for me, it's always come from a place where it's a privilege to try to help others.
It's a real privilege to be with people on their journey through life. And, you know, there's a lot of privilege that comes from just being able to be with people in their vulnerable moments and have them share that with you. And for me, it brings a lot of meaning. It helps me understand the human condition.
So that reward of feeling like you are a part of affecting change, I don't think can be downplayed.
This is a sector that changes people's lives in a fundamental way. This is we don't know what happens after we die, but we get one time to be alive. And if you're working in healthcare, you are keeping people alive or giving them a quality of life. I don't think there's anything more valuable than that.
I don't think there's another job that I would rather do.
And I'm grateful to be in this position that I can still feel connected to that original purpose after, you know, almost 20 years of nursing.
Don't give up. Keep going. Keep trying. If I could do it, you definitely could do it too, because I was a res girl. And I still am a res girl. And we can change the world.
We're going to be okay. We're going to be better. We got to come out of this better than we did going in. I think there's more awareness of each other and what we can do to protect each other.
I don't think there's anything we could have done to make it better. We got through it. I think that's as good as we could have done.
I don't know if we're going to be okay, but I have confidence in the people who I work with. And I have confidence in myself that we will do the best we can with what we have.
I think my whole life, my whole career has been about service. And so the way that I guess I view it is we have no choice but to go forward.
And we'll get through it. I mean, you have to, right?
What I've learned from my own experiences from languishing is that there is opportunities to change it into thriving and then eventually to flourishing. So I think we will get there. I'm confident of it.
We've actually seen the strength in the system. Yeah, we've seen the strength in the system.
And now that we are getting a bit more control over the infections, I feel like I'm seeing the old ICU again. I'm seeing myself the way I was before the pandemic again. I'm obviously not the same person, but I can be, you know, the best nurse that I can be. I can go home, feel accomplished, like I've made a difference, and it's nice to get that feeling back.
You're not alone. It's going to be okay.
And that we believe in you, and we believe in each other. We believe in the power and the goodness of people.
I see the world way more as we're all in this together, and we all need to cooperate.
We're in it to win it together.
I felt like we rose to the challenge and did the best we could.
I think we're on the better side of it. I'm going to look at it like that because that's just the better way to look at it.
I think I'm actually in a good place. I really am. The whole experience has left me, as I said, reassured. It made me realize that the people I work with are incredible. It's really bonded us. You can imagine you go through this event together. You create a brother and sisterhood that was there before, but it could become stronger. And it gives me faith that no matter what happens with us, I hope we'll be okay. I think that we'll be able to come to the challenge and succeed.
What you want to say to everyone is thank you. And I know that sounds simple, but at the end of the day, knowing the amount of time people gave, the amount of caring that they showed when they were worried about their own families and colleagues, they continued to show up, they continued to do what was needed, and they continue to care, and that's huge.
I think what we've now seen is with this and the recovery and or the rebirth and or the restructuring within healthcare, we're going to be able to build back better than we've had before and have an opportunity to really think about how to deliver healthcare in a better way.
Our job and our work life in the hospital, especially in the last few years, has been anything but routine. And you can choose to look at that as in a negative light, or you can choose to look at it as an opportunity to just get to know yourself better and see what you're capable of, and as well as your colleagues around you. And so, although the last few years have been very challenging, they've also been very rewarding.
We're a very resilient, strong group, and I do think that we will be okay. But we have to continue to look out for each other and support each other.
If I had a chance to speak to the public about how we go forward from a pandemic, I'd ask them for their support. I think, and this is not financial support, but this is support in saying how we can shape healthcare, how you can take ownership for your health, and how you can support us in being able to help navigate and recover.
When I think about everyone that we've met within the medical system, we feel very encouraged and hopeful. And so we believe the answers are all within us as both individuals and how we interact with and take up our responsibility to encourage and influence others into a more compassionate space, which calls on meeting each other's needs fully without compromise. That requires work of connection and relationship and getting to know one another in a more deep way. And that takes work. And we believe that is the work of this next era. And so this is our opportunity to harness the power and the ability to be creative and achieve that sense of safety and trust and vulnerability, which is where creativity and innovation springs from. When the tears have been fully emptied out, and when the grief has been fully expressed, when the pain has fully been felt, on the other side of that is the opportunity for joy to spring.
We really need to think of healthcare as a team, and really the center of that is the patient, and then their families, their community.
Patients and families are the main stakeholders, and public communities are the main stakeholders in healthcare.
So it is talking about a shared responsibility to health, because it's not just the healthcare system or the healthcare providers, it's actually a team for, and that includes the patients and their families.
We can actually have a community response for how we get through this, because healthcare is all of us. We all own it. We all pay for it. And so how do we come together to create some innovation in this space?
We don't want to start falling back into bureaucracy that would impede innovation. We know that there was challenges in how communication of, vaccines in the pandemic really led to mistrust.
I do think that if we could actually create more opportunities to educate the public, then we could have solutions that come from across the spectrum.
We haven't been able to communicate at a level that ensures that there is opportunities to ask questions and reach out to the public in a way that they feel comfortable.
The only way to do that is to bring us all together and to say, how do we talk about this as a shared responsibility?
Patients and families are in pretty much all areas of healthcare, including my own area of critical care, a key driver and a key source of positive change.
We need to continue with being open-minded to change, because what has worked in the past is not going to work now.
I think we're in a place now where we all have to come together.
The one thing that can help us move forward is to engage with the different Indigenous groups.
When my kids were in the school, I wanted to be involved. I wanted to have a say. I wanted to participate in what the school was going to do with my children there, right? We don't treat healthcare the same. And I'm not advocating for a parent advisory committee at hospitals, but I'm talking about that inclusion, that role of community and the public in this very publicly funded institution, right? This is a public health system. Let's put the public back into this health system.